Starting off with hypovolemic shock. This type of shock is caused by reduced cardiac output. Now, it may have multiple possible causes. It can also be termed as hypovolemia, in which the central nervous pressure is reduced and thus the venous return decreases. Now, as a result, the stroke volume falls. Now, this mechanism is called the Frank-Starling mechanism. The cause of hypovolemia can be bleeding or hemorrhagic shock or some other loss of fluid to the outside, such as via the gastrointestinal tract, for example in the case of severe bleeding, massive vomiting, or persistent diarrhea. The fluid loss may be via the kidneys, for example in diabetes, or high dosage diuretics, polyuria after acute renal failure, or the fluid loss may be via the skin, like in the case of extensive burns, profuse sweating without fluid intake. Now, loss of blood internally can also be a reason for hypovolemic shock, such as in the case of hemorrhage into the soft tissues. This may occur in fractures, especially of the thigh and the pelvis, or in the region of the retroperitoneum, or it may be into the thorax. The blood loss could be into the thorax, for example in the case of a rupture of an aortic aneurysm, or into the abdomen, which is observed in the case of a rupture of a spleen, for example. Now, apart from these reasons, the sequestration of large amounts of fluids in ileus, peritonitis, liver cirrhosis, or acute pancreatitis may also be a cause of hypovolemic shock. Now, moving on towards cardiogenic shock. Cardiogenic shock is decreased cardiac output, and it is evidence of tissue hypoxia in the presence of adequate intravascular volume. It may be a result of heart failure. Now, primary or secondary heart failure can be caused by acute myocardial infarction, acute decompensating heart failure, malignant arrhythmias, cardiomyopathy, acute valvular regurgitation, obstruction of large vessels like pulmonary embolism, or by the impairment of cardiac filling, which can be observed in the mitral stenosis, pericardial tamponade, and restrictive pericarditis. In these conditions, in contrast to hypovolemic shock, the central venous pressure is mostly raised, which can be termed as congestive shock. Hormonal shock can be caused by adrenal hypofunction, which is observed in the case of Addisonian crisis, diabetic coma, hypoglycemic shock, which is observed during insulin overdosage, hypothyroid or hyperthyroid coma, or coma that is observed in hypoparathyroidism or hyperparathyroidism, basically in both types of parathyroidism. Anaphylactic shock may be caused by food or drug allergy. We usually observe reduced cardiac output. Now, it may also be caused by peripheral vascular distension with venous pooling of blood, in which vasoactive substances are released, like histamine. It is important to note that metabolic toxins can cause decompensated liver cirrhosis and acute liver failure, and also uremia. Now, in septic shock, or it is also termed as septic toxic shock, the cardiac output is at first raised by the action of toxins, of usually gram-negative bacteria. It causes tachycardia and reduced total peripheral resistance. Initially, the normal blood pressure then falls. Respiratory failure occurs, and finally a late stage develops with reduced cardiac output and a high total peripheral resistance. And also disseminated intravascular coagulation may also be observed. Neurogenic shock is rare, but it may occur when, for example, the brainstem or spinal cord trauma or intoxication due to either barbiturates or narcotics. They disturb the autonomic nervous system, regulation of the heart and circulation, and the venous return is markedly reduced.